Hey, everybody. I am so excited, and I want to thank you all for joining us today. We have the Dr. Scott Munsterman and Dr. Steve Conway who are back again to update us some more on all the comings and goings that have to do with COVID-19. They are here to answer your burning questions, all of the ones that you have been sending to us over the last couple of weeks. If you have more, be sure to drop them into the chat box and we will answer them throughout the broadcast. Listen, don't forget today's webinar is being recorded. A link to the recording is sent to every single one of you. You do not have to request it. We want to thank you so much for taking time out of your incredibly busy day to be a part of today's webinar. Dr. Munsterman, Dr. Conway, take it away.
Oh, well, thank you very much, Christy. Yeah, and welcome everybody. And, you know, as we've been talking about a lot of things in regards to COVID-19, we thought it would be a good time to start to pick up some of the loose ends. And so my good friend, Dr. Steve Conway is here. And Steve, you know, as we've kind of worked through this presentation, you and I both have worked long enough and close enough together to know that we just jump right in, right?
Exactly. Let's just hit this thing. And well, there's so many things. Again, we have a lot of people calling us, asking us questions. And we started noticing that there's a lot of information out there. There's a lot of stuff going on. In the beginning, everyone knew nothing, right? So it was just this pretty much inundated with information. But now there's certain things that are like, what about this? What about that? Or how certain are you on this? All those different things. So we thought, let's put it all together here and do our best to kind of bring things together for people.
Yeah, a little bit of odds and ends, but then also, you know, we've got some things to talk about that are, you know, somewhat timely as well.
Your stuff is a lot of questions coming in right now that I think people are probably having.
Yeah. So again, we always want to provide our special thanks to it's taken a village of experts and that have even fallen outside this group that we're close to, and we certainly want to acknowledge that. And then of course the disclaimer is we only know what we know, but we've done our best to do our homework on everything. And yet I know, Dr. Conway, you subscribe to this somewhat too, the old phrase trust but verify, you know. So as we continue to do our work on nailing down the primary source verification, you know, the horse's mouth, if you will, that's where we go, and we try to figure things out, and we go right to that source, and then we digest it, and we just are able to, I guess, think it through and get it ready so that we can talk more about it. Dr. Conway, did you want to add to that disclaimer?
Well, I agree. It's even before we went on air here, all of a sudden I got another question over the internet. I heard this. Is this true? And it's something we're going to talk about today. And I'm like, oh, wow. Okay. So I didn't have time to go back and look and check these things out. But again, everything's moving so fast and there's a lot of different things happening in there. So again, this is true as we know it right now.
Yes.
But the facts are, there's a lot of things changing. And we'll talk about that in the next slide there a little bit as we move through the clarity aspect of it.
Yeah, and so one of those things that we've had come down the pike have been the Health and Human Services payments that have just like showed up in providers, in their bank accounts, you know, and they probably heard a little bit about it prior, and of course, you know, some of the key points there that we just need to understand is that was the initial part of a $50 billion package, which we're going to get into more detail on now and talk a little bit more about it. But that was the initial $30 billion that was just sent directly into providers' accounts. There was or is a term and condition portion of that, which we will walk through, that they are asking those clinicians that receive that payment to attest to that within 30 days, those requirements under the terms and conditions. And if you do not attest, then it is an automatic attestation because you've accepted the money if you didn't send it back. And then we're going to talk about the second 20 billion that a lot of doctors don't know about, right, Dr. Conway?
Yeah, that one's popping up now, and it's a little different. This one's not going to be automatic, so there's certain things you have to do. So again, we have some screenshots. We're going to go through that with everyone so you can see it. And I tested this out yesterday and some of my friends up here in Wisconsin and just asked simple questions. Do they know something about this? And they're like, not a clue. And these are really good people. So they kind of went through it and said this was very helpful. So
yeah,
and then
perfect.
I also want to talk a little bit on the very top up in there too on this clarity, because I am getting questions coming in from chiropractors, and it is uncharted territory, and they want to do something correct, right? They just want to do it willy-nilly. But as one chiropractor sent me an email say, I need to be really, really clear. Is this the way it is? And it's hard with something this new. Mm-hmm. So when when new legislation comes out or any type of process like that, it's gone through hearings, it's gone through a lot of legislative intent. There's all these different things. So you can get some contextual idea of what they want to do. And then after that happens, you have a lot of case law, right? It's interpreted in the courts. There's all these different things you work with. And after all that happens, you can be pretty clear of exactly what's going on with this. But when this stuff comes out, I have multiple resources. One of my favorite is the National Association of Chiropractic Attorneys. So these are the attorneys that work for every single state association. We have our own little chat room. We have our own little world that we live in. And I can tell you, we have been just red hot lately with all the different things coming up. And a topic will come up, let's say on this one here, is it like every patient, or should chiropractors be treating COVID patients, right? Because it says you're treating COVID patients. Mm-hmm. And we had one attorney say, no, we've advised our chiropractors that they can't treat a virus. And I'm like, okay, that's not exactly what they're saying. So we have all these arguments that we're working through, but even with attorneys, we're working back and forth. And then we come up with what we, consensus, that with the information we have at the time, this is what we have worked forward with. And same thing with the employment law. On HHS here, we've brought forward fantastic attorneys that's all they do is employment law. And everything they said, we had one seminar, and then by the time we did our second seminar, the information had changed. And so it was true at the first one, but by the second one, we had new information. We had to keep updating it. So as this stuff goes, we're giving, again, the best we can at the time. But if there's anything we can clarify and work with, we obviously will do this if new information comes out.
Right. And, and I don't know how many, and I should have introduced you properly, Steve. I just thought of that.
Oh,
now.
No.
I know you're nationally known, but, Dr. Conway is a second generation chiropractic clinician, and he went on to become a healthcare attorney. And so out of Wisconsin, you do a lot of lobbying and representing and defending chiropractic clinicians and in a lot of different ways. And so we've known each other for quite a while and worked together in a lot of different issues. And so coming from that background perspective has been so valuable to helping me understand a lot of aspects of what's been going on today in regards to, this whole new venture we've had with COVID-19.
It's been an interesting month.
Yeah, absolutely.
All the things getting out there. And the chiropractors have responded excellent. All the chiropractors out there are doing the best they can to do the right thing. So our profession has really done well with this. Yep,
I think so too. All right.
And
so as we talked about the initial $30 billion, I think we've covered that. That's something that's been out there that a lot of folks have providers have.
Hit one slide back because I haven't read down there for everyone too, because this question kept popping up. When you get in that attestation section, they wanted to know, what if I close my office? I don't even know if I'm treating COVID patients, and I don't know if I feel comfortable signing this. That question came up a lot. And so we passed that around to all the different attorneys, all the different people I knew were working with that. And this is actually from, HHS came out with this, that HHS broadly views every single patient as a possible COVID case. So again, if your office is open, you're treating patients, HHS is right now, their interpretation as we know right now is that they're treating every patient that comes in your office as a potential.
Yeah, thanks for stopping me there.
Yeah, because that's a big deal as far as signing.
It is a big.
Because even though you got the money, you have to attest to it. And that was where I actually knew a lot of chiropractors that were turning the money back, saying, I don't feel comfortable signing that. And I'm like, okay, it's always your choice.
Right.
But then this came out with the explanation. I think that really eased all of our minds on really what we're treating and we're working with.
Yeah, exactly. Very good. And of course, they had partnered with UHG to get the payments out rapidly and all of that. And as we mentioned earlier, you've got like a 30-day attestation time period that if you are going to refuse it, that's the time to do it, because at the end of that 30 days, it's automatic then that, hey, you've agreed to keep the money. And so you are essentially agreeing to those terms and conditions. And of course, this is on that first tranche of 30 billion, right, out of the 50. And so then we have what's called of course, this is the CARES Act Provider Relief Fund. And if you go to this website, and we've got some links here for you to be able to check and be able to take a look at. Let me bring that up. This is what you're going to see. And of course, there's two parts to this, as we've talked about. We've got that initial $30 billion, and this is the attestation portal right here to be able to attest to that. We're going to walk through that here. And then the next thing that we're going to do is when we start talking about the 20 billion, we're going to go ahead and walk through the general distribution portal. But this link brings you right to both for you to be able to do the work that you need to do to attest to that.
They're both different. So just because you get the money in the first one, do not assume the second one's going to be the same. It is a very different procedure.
Right, exactly. And so as you attest into that first money that you got out of that 30 billion, this is the attestation portal. And what you're going to open up, just like what I opened up that web page, you'll see that first part of the CARES Act. You'll be clicking on that active link, and then there's 4 steps to confirmation. And so this is, again, attesting for the money that you already got, right? And so you'll work through the process, and you'll be putting into that section the 6 digits of your deposit. Your billing TIN number is what you've already put in. You'll be writing in or entering in the amount that you were paid in the next screen.
I'm going back just one, though. Questions I was getting in are on the TIN. And some of the questions were, is it like my office, or is it individual, or, those type of things. But I think it ties back to the money you got, right?
Right.
And most of them are going to be how they're billing out. Most of them are billing out as their office, their business, not individual within.
Right. And so you can see that it states your billing TIN.
Right.
And so that's exactly right, Dr. Conway. You want to use that. And if you have any questions, I mean, not everything's as simple as it looks.
No, we've gone through this, people. Yeah.
Yeah. And so you may need to refer to your CPA, and to be able to ask them questions and say, okay, which one should I use? And then to be able to and there are other, if you have a variety of TINs that you are using, that you're being paid on, if you have multiple businesses or whatever the case practices, that type of thing that are set up differently, certainly talk to your CPA, but this is set up for you to be able to put in those other TINs as well. And then you move on through the process, you review and you accept the attestation, and what you're accepting then are those payment terms to that attestation. And once you've clicked through that, and
can you go back to that one there? Because there's been a couple questions on this too. Again, the writing here is microfilm, right? It's very tiny, but this is where that I'm treating the COVID patients.
Yes.
So this is where that came in, and this is where a lot of chiropractors became concerned on that aspect of it. There was another part of this dealing with the networks and accepting out a network. I think that was in here, wasn't it?
Right.
On this section here too. So on that one, the questions I was getting, the concept was basically the federal government was assuming that everything was going to be overwhelmed, right? All the hospitals, everything was just going to be overwhelmed by all these COVID cases. And thus patients that normally could get into their in-network provider were just not going to have that access. Yet if they came to your office and still needed the care, then you had to be dealing with this in and out of network co-payment type provision. And so that was in here too. So some were curious about that. And was that going to change their par, non-par, stuff like that, which it doesn't. So for chiropractic, I don't think you're going to notice a big change with that, but a lot of questions came in with that. And there was some fear about hitting this button if I didn't really understand how to work that. But I don't think that's going to be a big issue with chiropractic. That is going to be more of an issue, I think, with hospitals and medical providers, but not really what we do.
Yep, exactly. That's a great point. Thanks for bringing that up. And then further on, we've got, just contact information, billing address, and then of course, just the final confirmation. And then what happens is that once you've completed it, then you do get a reply email that verifies or validates, that it actually went through, and that all of that has been taken care of, and you've got that validation, if you will. So that is for the first money that you got already, that out of that 30 billion, if you will, in funds.
And wouldn't you say they should put all this information in their compliance manual?
Yes, thank you for that.
Print all this stuff out, have it in your compliance manual, just to have.
Yes, and the other thing that I recommend as well, Dr. Conway, is to do screenshots. So that when you go through and you do screenshots, anything that you can do that will document the process that you went through, and because what happens sometimes is that mistakes are made by CMS. I mean, it just happens, and so they may not have record of it, and you read it somewhere, right? And so just make sure that you either print out hard copies of things or screenshot, save them, and then put them in your compliance manual. To your point, Dr. Conway, because that's a great source to be able to refer right back to and say, okay, we had this situation. Here's how we handled it.
Well, and on the last one too, the money that you got was based on a formula. Right? They took what you billed in and then they divided it by what, 2.5 billion?
Right.
And then multiplied it by another, can't remember the number right now, number. And that's what it came up with your basic, it's like your percentage of the entire pot based on what you billed. And so I would recommend kind of looking, make sure you're in that zone of that amount, because you don't want to get way overpaid. Like all of a sudden you got $1 million in your thing thinking, ooh, life is good here, which really doesn't match. They may have made an error. I did hear of one person that really received a large amount and it was just an error. So again, just a double check type thing, just to make sure your payment was in the zone. It doesn't have to be down to the penny, but it's in that zone.
Yeah, exactly. That's a great point. So now that leads us into the 20 billion. I mean, the general distribution portal, and by clicking on this link here, it'll bring you right into that distribution portal, and it is a DocuSign. And again, you're going to be looking at accepting terms and conditions of this to be able to, and that you also will be submitting general revenue data for the calendar year 2018. And so as we walk through this, again, we go back to that web page that we showed earlier, and just below where we were at on that first money brings us into the general distribution portal link. And so as you open that up, you're going to begin, and you begin by entering in your billing TIN.
Should we also let them know too, you're going to need your tax information from 2018.
Yes. Very good.
It's kind of like before you start, be good to have that. Otherwise, you're going to have to get it and need it. And in this one, you also have to look to see, because this one's related to, do you actually have a loss in March and April? Because I had a chiropractor today called me up, said he looked at all this stuff, but he's doing okay. He actually did better than 218. So really there was nothing there for him. So
right. Yeah, and so that's a great point, is that the whole reason for this second tranche is to evaluate, okay, do you really need it or not?
Yes.
Kind of thing. And they're going to relate it back to what your monthly average was for 2018 based on your income tax returns.
Yes.
And those gross receipts that you will turn in as a part of this application, if you will. And then you'll have to go to your March revenue, just like you said, Dr. Conway, and your April revenue and collections and say, okay, how far off was this now?
Yeah, and I think you're going to see this because, I mean, I've averaged nationwide, I've seen a downturn in chiropractic about 30-40%. And so I've seen most offices are going to be less than where they were. But again, it's one of those things you have to look. The other one was automatic. It was just there, easy. First time I think Medicare has ever done something like that. I mean, be that easy to get money back. This one's just a little bit more involved. And so you have to be prepared on this one.
Right. Exactly. And so as you work your way through the system, you're again validating your bank account number, what you currently received. And if you did not attest to the first part of the money, it's going to stop you right here because we've had that happen with clients as we've worked through the process with them, and they have to go back, make sure they attest to that first money. But as you do that, then you'll be able to move forward with that and create that submission and that confirmation. And then that brings you into this window where you're entering your name and your email address and beginning that process. And then as you sign in and work through that, then you'll be able to.
In the email, when you fill that out, they send you something to your email. They'll send you a number, right? And then you have to apply that into this.
Correct. And then that access code allows you access to move on further into the DocuSign routine. Exactly. And then that application actually overall is fairly simple.
It's easy
in its approach to be able to go ahead, enter it in, being able to, fill in the blank, if you will. As you hover over these red box areas, it will show what they're looking for exactly on the tax return, which box number on the tax return, to be able to do that. And then you just work your way through that process, and then you're able to go ahead and complete that. And as you get to the end of this form, then you can see where it says, okay, what are your gross receipts of sales? And this would be for 2018, correct? And so you would be putting that in, and then you see just below that, then, okay, now revenue for March, revenue for April. And that's where you're giving those numbers that you had for those 2 months.
And this is not just Medicare. This is your gross revenues.
This is gross revenue, gross receipts, exactly, that you had bring in. And then of course you see the little paper clip there just below, and that's where you would click on that, and then you would make your attachments of the 2018 tax form.
Yeah.
So all in all, it's a fairly simple approach.
Not
overall.
The first time you do it. That's the hard part. So if you do it multiple times, it becomes simpler. But if you're just the first out there trying to find it and work your way through it, and all of a sudden you're moving back and forth, it just wasn't easy. That's why we thought we'd do it this way. And again, these are slides that they can get from CHUSA, right? So Christy, I think, automatically sends it out, or all those that are attending. So we did it in this format so you could just kind of see it and work back and forth, and hopefully it will help you.
Yeah, and it's kind of nice to know what's ahead when you're, otherwise you're just seeing one screen at a time, and it's like, okay, how long is this going to take, and what do they need? But to recap, as you mentioned, Dr. Steve, be ready with your 2018 tax forms. Be ready with the revenue that you collected in March, that you collected in April, so you have that. Be ready with your Medicare number, your PTAN number. Be ready with your tax ID number, your billing tax ID number, and then you're pretty well set to go.
Yep, and already make sure you attested to the first one.
And attested to the first one. Yep, there you go. Very good. So we're going to switch gears a little bit here, and let's talk a bit about employment law. And one of the neat things that early on, what was it, probably 5 weeks ago, was one of the very first things. You, Dr. Conway, brought on some of your legal colleagues from across the nation, some key experts in employment law, which was very helpful. So why don't you talk a little bit about that, because you've noticed that there's been some updates, with exemption or that type of thing. And as we bring staff back on board now, whether you shut down completely or not, we had a lot of practices that had to kind of lay off some folks, and now we're looking at bringing them on. Talk to us about that.
I would highly encourage, since these are all, they're all recorded. There were 2 of them. And if you go to those and get those from Christy, I brought on 3 attorneys, employment law attorneys from Milwaukee, Wisconsin. And we were doing this for our state association here in Wisconsin, realized that this was nationwide. It was hitting everybody. And so again, we came to CHUSA, and with Dr. Foxworth and Christy, they just said, let's get this nationwide and work with it. So with those 2 processes, I would probably watch the second one. I think that one is more up to date, would help you. The first one was with the information we had at the time. And then the second one was really not, I think it was just a week later, but the things had changed so much because new information had popped out and dealt with it. But the thing that hit right away was they did change some laws, and these went in effect on March 13th, where they were signed on March 18th, and then they went in effect on April 1st. But what the big deal was the laws were dealing with Federal Medical Leave Act, paid sick time, all these different things that usually and generally only affect employers that have more than 500 employees. So this is something that chiropractic offices, unless you're extremely big chiropractic office with more than 500 employees, this is something that really wouldn't touch you. And the other big point was 50 employees. So if you had 50 employees, there were certain rules you had to work with, and over 500, there's other things you have to work with. So this was the first time that it actually went down to our range, where you see the average chiropractic office, where we may have 1 to 5 employees. New laws came in effect, and that's why we went very quickly and very fast with the first seminar, because it did affect especially the paid sick time leave and Federal Medical Leave Act, because all of a sudden now not only was it affecting chiropractic offices, but your employees now were finding that their children, the schools were shutting down. So all of a sudden, and there was no daycare. So all of a sudden now they had all these kids and children that they had to take care of. And all of a sudden they're asking for time off. There's all these different things you're working with, where all of a sudden you have new rules that potentially you're going to have to be working with. That's why this was so important when we started. By the second week, they had come out with the exemptions. And I think that's key. So maybe we can move forward a little bit on this here. I think I just hit those. So this only lasts through December 31st. So that's how this works with it. But these are the 2 key components that came in, and they were big. And so again, all the attorneys in all the states were really working on this to make sure that all of our chiropractors understood it, knew what to do, and worked with it. But then this next slide here, well, actually it covered all your part-time and, counting these up. You had to count your part-time employees too, which was a little different. Usually a lot of times you could distinguish them out from full-time employees, but this counted everybody. So if you can hit the next slide for me, I want to go to let's move up to the exemptions, because this stuff here, I think this all came in, and right here is where I really want to get to. So when this came out, this really changed the game. Because what the other one, and I can go back to slides, but I just don't think it's going to be as effective or important right now for our chiropractors unless they choose not to take the exemption. So if you're gonna say, I do not want to take this exemption in my office, and I want to have all my employees follow the sick paid leave and the new emerging Federal Medical Leave Act, then get these slides, get this data, because the stuff that we're kind of going to skim over here today is important for you, because you're going to need to know this. But this one exemption came out, and it's this first paragraph here, and it was interesting. Basically what they were looking at is the federal government all quickly realized that if most doctor clinics were like the size of the chiropractic offices, right? There was a lot of these out there, except for the big hospital systems, but a lot of physicians and healthcare providers were going to be in this area. Then all of a sudden, all their employees and all the doctors, they just would not be there in order to treat patients. So they needed an exemption. And so this exemption came out. And so the exemption is basically for all doctor offices. So it's anyone employed at any doctor office. And so they listed it off, and a chiropractic office would be included in this exemption. So the key word here that we are working with, again, this is with all these attorneys nationwide, we're going back and forth and looking at it, was, does this only include in a chiropractic office? We have basically our chiropractic technicians that help us with therapies, right? Help with examinations, clinical work, x-rays. And then we have our clerical that help with the front desk, people in and out, insurance, all those different things that maybe aren't really clinically related, but are important to your office. So we were asking, does this only apply to our clinically related employees, or does it apply to all employees that can be exempt? The consensus right now, and again, going back to that clarity thing, to the best of our knowledge, the information we have right now is that it says on there, anyone employed. So we're going with the anyone and saying that all employees in your office are critical to you providing the services to these patients. So they're included. So basically this exempts the chiropractic office from having to worry about the paid sick time and this Federal Medical Leave Act type happening. So it was a big deal. So again, there's the, you'll see on there, we have the link, so you can go find it. And what's nice about that link, it goes through a lot of questions. So if you're a chiropractor, and I notice on most of the previous seminars, the questions popping in, that link takes you to a question answer format. And if you go, the question answer I just gave you was number 56. There's a lot of them on there. So you can work your way down, but pretty much any question you're going to have with this whole field of my employees, what's going on, happening, is in one of those questions. I think number 20 right now is the one, let's say I have an employee who just does not want to come back. They're off. They don't have COVID. They're not treating someone with COVID. They just have a fear of coming back to an office. can they remain off? And the answer is no, they can't. So that's one of the questions that you can see in there and work with. So again, it's a great resource for chiropractors.
Yeah, that's excellent. That's excellent.
And so again, now again, the chiropractic office is exempt, but there's also another exemption that they did too. But this is again, just data to have if you want it. But what a lot of these small businesses were saying, which could be a lot of chiropractic offices too, is basically, I just can't exist without my staff. So if they can't be here, they're trained, they're specialized, I can't bring someone else in just to do it, I'm not going to work. And so that would be an exemption for your company you could work with. But because based on that last slide and the interpretation we're working right now, where it says any doctor's office and a chiropractic office would be that, I would take that exemption and work with that. And the question I got a lot of chiropractors ask me, do I have to apply somewhere, right? Do I have to send some document in saying I'm exempt out here? And you don't, but you need to document inside your office and let all of your employees know that you're taking this exemption and that this exemption exists. So you have to have documentation that you're doing it. This is your position in your office. And then the other part is that you've informed your employees that this is where it's going to be. So they know. And that's about the two things you have to do. And again, put that in your compliance document folder manual. So you have all this written documentation there.
Yep, exactly.
This is one question I got quite a bit too. And again, you can furlough employees and they're not entitled to paid leave. And the only thing you have to really watch for this, and this is one thing that this question popped up a lot in the last seminars, and I really want to be careful with, is chiropractors, because they've not been in this employment, well, this stuff you may have touched before, you can't discriminate, right? We understand when we're hiring someone, we can't discriminate on sex, race, sexual orientation, all those different things. And the same thing is when you're doing anything like termination or furloughing. You have to be very cautious that there's not even an appearance that you're doing something that may violate or discriminate against one of your employees. That's just kind of caution on that. But most chiropractors have really never been here before, right? Generally, if someone leaves, it's because they just weren't working out or they found a new opportunity. But it's never been where we've had uniformly or the business has just dropped down like this.
Right.
And unexpectedly.
Just a real quick point on that too. Within employment policy, as we've worked with clients, we actually have that built into the employment policy that if you did have to furlough people, here's how you would bring them back. And it would be based on a criteria, those folks that have been with you the longest or our full-time status or that type of a thing, and having, it not based on anything else other than
that's excellent.
How you let them go and how you brought them back, that it's all spelled out.
And I think that's what we're finding out too, because again, what we're talking about again is this Chiro Armor, where we do this work and we have all these compliance things, we're helping people. What chiropractors are finding out with this is, I didn't know.
Yep.
Right. And these are all things you have to have within your office. You technically need all this information in. You need all this stuff in your compliance manual, all these employment laws, all these different things. You have to make sure you're doing them correctly. And most people just didn't know that they had to have it. Right. Same thing what we're going to get into here with the OSHA, because I've done a lot of occupational health in my life and worked with companies and did a lot of work with it. And it's not a sexy topic. And when I try to explain to chiropractors that this is something new in your office, they think, they kind of think I have my x-ray machine and I have to do something with the chemicals. That was OSHA, right? That was the whole extent of it. Yep. I'm like, no, there's a lot more to that. And but at the time, no one really could put anything reality, right? There was nothing tangible they could work with until all of a sudden this COVID came up and boom, everyone's like, I have to do what? How do I do this? All those different things. So again, what we're going into next really shows that if you have it set up beforehand and understand what's in there, you're going to be protected all the way through. And a lot of people were caught short on this one.
Yep.
And what was this one here? I have to go back. Sorry. Okay. Yeah. So this was getting with the PP loan forgiveness thing. And again, this question came up quite a bit too. So they're wondering if that was going to affect it, right? Where this employee just would not come back. And it won't, because you have to make the offer. You have to make sure it's in writing and all the other things. And the employee's just rejecting it. But the employee has to understand, by rejecting this offer to come back, it's going to be further to get unemployment. They can't just sit out there because they're scared. It's just kind of the way it is. And then what we did is, this is for everyone. You have to have posters in your office dealing with this. Even if you're exempt, I would recommend getting the posters up there, because at least, they're required to be there, and having the exemption is a factor, but I would definitely put these up. So this is a resource you can go, just click on these, the posters pop up, and you can just download them and print them out, and you're set to go. We put quite a few posters on there.
Mm-hmm. Yeah, that's perfect.
Now, I think because I think most chiropractors are going to do this exemption, but there are basically, if they don't, should we just leave this for that they can get the slides and they can work with this?
Yeah, I think so. And if they have questions,
I think so
they
too.
can
Looking
certainly.
at our time, what we have.
Yeah.
So what I have for you here is basically get these slides, have them handy. If you decide you do not want to exempt and you're going to go that way, then there's basically 6 ways that an employee can say, look, I need to have this paid time off. And there's different things they have to do to basically get the Federal Medical Leave Act. And a lot of this is based on how much you have to pay. There's caps. There's like a $5,000 cap. There's $2,000 cap. There's certain hours that you can cap. So they did make this so it is fair as they could to the employer, right? So that employees just don't go forever on these different things, because they realize you're small. You realize this is a factor for you. Again, they have those exemptions too. If you're just not going to go as a business, it's just not going to work. But these are all just the different data that if you decide you're not going to exempt, and you have employees that want to take the paid time off, or they want to do the Family Medical Leave Act, this would be data for you to use and work with.
Mm-hmm. Yep, exactly. So thinking about the employment law and all the things that we talked about, Dr. Conway, any kind of action steps for our doctors at this time that you can lay out?
You hit the one. I think for right now is get the posters, make sure you have the posters up.
Right.
Make sure if you're going to do the exemption, which, I mean, you have to make that choice. Mm-hmm. But that's a choice that's sitting there. If you make that choice, then you have to let your employees know you're making that choice. And then use this information in here, just that one resource, that link, action step, download that or go to it. It has all the question and answer format. And it really goes through, what if my employee does this, or what if my wants this? I mean, they went through all the different things. And I think that's just a very good resource for you that you can go to. And then if you have questions after that, because you get an employment law is a lot of state specific, then you need to get an attorney within your state that can help you. And a lot of the state associations have an attorney that you can work with, or you can, work with your local attorney dealing with some of these things, because there may be some different employment law things that will pop up that you're just not familiar with.
Right. Yep. Very good. Very good. So then last topic we want to kind of push through here.
Very sexy one. We saved the sexy one for last.
Huge. Right? Oh, it's and it's so much fun. It's so much fun. Yeah. But it's the one that caught us all flat-footed. A lot of our. This is the one that caught everybody
flat-footed, and now they see how important it is.
Yeah, and what we were exposed to, quite frankly, was OSHA. And just one part of OSHA, and that's the exposure control plan, when it comes to infectious disease, but there's other areas, and of course all this falls under the general duty cause for OSHA. But besides the exposure control that we've been exposed to, OSHA needs us, if you will, and by law requires us to have policy considerations in all of these areas.
Right.
And we're not going to dive into all of those, but we've done that already. And you can go look back at our previous webinar that we've talked about these in detail. But we just thought it would be good, again, to be aware, and realize that now is a great time for us to kind of get things into place and right. Understand that, excuse me, that, we've had exposure control thrust upon us. And then we've seen now, and quite frankly, my experience in compliance, not much has changed with OSHA for years. I mean, frankly, not much until a few months ago. Then all of a sudden we had a lot of this stuff put into action, if you will, and then the CDC's brought their guidelines. OSHA and CDC work hand in glove together in many ways. And so now we've got an updated version of what we really need to have a good exposure control plan, if you will, and understand that we do have some standard precautions that we need to take into consideration. And that, in my mind, Dr. Conway, will be something that will be with us moving forward as we think about infectious disease and assuming everybody is infected, and understanding that and having things in process.
Well, and again, those that's been practiced for a while will remember when HIV came in. And so that's where also it was a similar type action step inside a lot of chiropractic offices. Because at the time before that, it really, you knew about this, it was just there, but that opened up a lot of things. And all of a sudden everyone was wiping down their tables. I mean, it was almost very similar to what we're dealing with right now. It wasn't pandemic, right? So everything was shut down and you didn't have to, 6 feet, all the other stuff going with it. But it was the first time that a lot of chiropractors really understood that OSHA was important. You had to do specific things. You had to have these things within your office for a public health standpoint. But again, it was very prominent, and then it slowly, like a lot of things happened, right? It just got quiet. And I'm assuming a lot of the younger doctors, if they're just starting now, wouldn't even be on their radar.
Right.
And so I think this recent pandemic has put it on everyone's radar, but it's always been required. And I think the key thing now is not to let this just go softly in the night like HIV did and think, ooh, I've made it through these 2 months. I don't have to do anything. But now's the time we have to look and say, what else am I missing in my clinic? What else should I be doing? It's a time to really do this overview of your entire clinic to see what else do I know that I don't know, right?
Yeah, well, yeah, exactly. And, we've had Aaron Reynolds on as a guest speaker too.
Yep.
And one of the things that he brought up is that because this has impacted everybody, in different ways, but it's impacted everybody. There's a certain expectation now that the public has for healthcare facilities.
Yep.
And that their trust that's going to be a component of their trust factor.
Here forward.
From here forward. And so, again, what we've done here, and this is a bit of a rehash, but we thought, we're going to give you the slides. If you want to self-evaluate your current safety and health program, OSHA has some great tools out there. You can go ahead and click on that link. They've got like an implementation checklist that you can utilize, and then a program audit tool to be able to audit what your current program is that you have in place, your current OSHA program, and audit against that what they require, and then you'll know where you're deficient. We've also had just a full lineup of resources that we've done our best with the expertise we have. Dr. Conway will attest to that, and he's been a big part of that, that you can access and be able to get your practice ready to go. NCMIC, just within the last 2 days, Dr. Conway, I know you saw it as well. They've got a nice little framework checklist. So utilizing those things to kind of get your thinking wrapped around, okay, what do I need to cover? What's my plan of attack? Documenting that can be so important. And then lastly, too, before we get to questions here, Christy, because I know we've got some probably lined up for us, is that ChiroArmor has put out there a special COVID offer, significantly reducing the price of our OSHA program for the profession. And we just felt like it was such an important time to invest in the profession. And then we also have free OSHA guidelines for you if you want to do this yourself, that lays out what you need to do to get things in place. So we just urge that you would go ahead and use this time now, as you've mentioned, Dr. Conway, to get things right in the practice, especially in this area.
I agree. I had a wrong button. I'm seeing all these questions pop up in here now. So we'll try and do our best with a lot of these and work with it. Is that what you want to do now, Christy?
Sure. I mean, I'm ready whenever you guys are.
Okay, good.
Oh, we're ready.
You hope. I don't know. And this was interesting here. She didn't receive anything the first round. So you might want to look to make sure you have to build in, right? You had to receive payments. But if they go to that portal, there should be a way they can find out if they didn't get any money. Is that what you're familiar with too, Scott?
Say that again. I'm sorry. I was starting to read the chat thing when you were talking.
So I just started that bottom one there, the first one in. She didn't receive anything yet on the first go. And so I think it's pretty much most chiropractors I've seen so far, if they build in, they receive something back.
Yeah, and those payments could still be
They
maybe
could still
coming
be
out.
in, but I'm thinking that first one they should have it by now, I would think.
Yeah,
I know
yeah, and I would probably go through your bank statement. Yeah, go through when what you're looking for is HHS payment is the
right. Now,
description.
some might get checks though. Remember, I saw in there that if they didn't have the automatic, some were going to get checks, so maybe the checks are going to come a little later. That could be a factor too.
If they didn't have your direct deposit information.
No. What we'll do though on these things here too, it's always, as everyone can understand, some of these are just difficult when they first come in, but we can actually, what we do is we always take these questions and then we go back, and then when we work with these, Christy, it's before you send it out, or you just keep updating the people that are on with the information?
I just keep updating them.
Yeah, okay, so that one we can update too. I'll see what I can find on that one too.
Yeah. I see that some doctors use their 2019 tax return on the second round versus 2018. And what's kind of interesting about that, and Dr. Conway, you and I had this conversation, I think, yesterday. Yeah. I've seen where they've asked for 2018, and I've also seen where they've referenced 2019.
Yeah, I've seen both too.
I don't know if it's going to make a difference. So I would just go ahead and document what you've got. And if there's a significant difference between 2018 and 2019 and they come back and do an audit, then there may be something there that you would have to change. I don't know. But yeah, that's a good question. But I have seen where they've said 2019 as well as 2018. And of course, when we went through the screenshots, you could see they were asking for 2018. Now, we've had some new doctors that weren't in practice in 2018 that were in 2019, and we just said use 2019. So will they be fussy? I don't know.
We don't know. Again, it's brand new. There's nothing you can. It's almost like, you know, when you're a new practitioner, you have some information, but it's not the same as someone who's been out 30 years and, you know, seen so many different people. Your database is just not the same. Your knowledge base. So we're working off what information we have. There's a question here: is it going to be deducted from future billings? I don't believe so. I think this was a payment with the emphasis of basically saying we understand you're going to be losing revenue based on all the stuff that we're requiring and all the different things happening. When they stopped essential things that you could be doing, they limited the people you could come in. So it was really a way to make you whole. Right.
And all our conversation today has been about HHS payments.
Right.
And yeah, but not the payroll.
Not the PPP.
SBA
no,
rule.
That's a whole different thing going on with that stuff too.
Right.
And there's a question here: is par, non-par? I've not seen any difference between par and non-par. It's been no difference that way.
Right.
As they're working their way through.
Christy, are we missing any here?
No,
we just jumped right in.
I know. I was like, man, they don't even need me anymore.
Yeah. Here's an interesting one too, and I thought
yes,
the
we
same
do.
thing. This one came in. It's like, because, and I brought this up a couple times before too. Is because we're off center. This came up. Remember, Christy? This came up in our employment law seminar that we had when they were talking about income coming in, because we were also saying that you as a chiropractor, there's a whole unemployment now for self-employed that we went over in that whole aspect too. That was a big deal. So again, if you went through that, there was benefits for you, which were never there before. They never had unemployment for self-employed before, but that was there. But we had chiropractors where we're trying to explain, like, the business I do today, I get paid, unless I get it right over the counter, right? 100% over the counter, I'm getting income from work I did 2 months ago or 3 months ago. So this is a very good question up here, is basically my income that I'm getting in April and March and May were basically from when there was no problem. Mm-hmm. Yet what I'm going to see now in June and July, as a result of not having this work done here in April and May, that's a really good question.
Right.
But right now, they're just asking what you have right now, this data, right? I don't think they took that into account.
Yep.
Well, I think
the hard part, this is where everyone, when you look at stuff, I'm amazed at what they've gotten done in such a short period of time. Mm-hmm. I mean, when you look at, we're within weeks. And if you work in government, like Scott and I have worked a lot in government, it's slow. I mean, it's purposely slow so you don't have all these quick knee-jerk things going on. But the amount of work that they've done, and actually to have all that money in your bank account in that short period of time, was just unbelievable how they did it. So again, these are things that will pop in later, but right now that's the only information we can give you.
Yep.
Okay, I think that's pretty much, they're getting to be about the same here, I can see, aren't you?
There was a question. Go ahead, Christy.
Go ahead. I'm still reading.
There was a question about, can you apply for this, the HHS payment? Of course, the first one came direct.
Yeah.
And then the second one, you would be applying. Yeah. And, and Dr. Conway, you talked a little bit about the definition and the terms and conditions, about the impact of COVID on your practice. And so if they had closed their practice and maybe they're going to begin to reopen, I guess in my opinion, they still qualify for the HHS payment, but based on what you understand, how would you answer that question?
Yeah, that's what that's been run through all the cycles that I know, and everyone's agreeing with that. But again, that's like I said in the beginning, everything is new. So we're using our best information that we have at the time, our best opinions, but that is the consensus right now.
Right.
Because it does say in there, it understands that you may have closed. And it's again, I think it's not, the wording is the best they could do with the short period of time they had, but the intention was they want to make sure you got this payment.
Let's see here. We had a question about receiving $8,000 SBA. Where did that come from? And that would have been that individual probably has 8 employees, full-time employees. You were paid under the Economic Disaster Injury Fund, up to $10,000, but $1,000 per full-time employee. And so that's where that would have come from.
I know it's amazing because there's the loans, the different types of loans, right? And also these HHS payments coming in. There's just all this new stuff coming all at once. And it's a little tricky to understand each section of it.
And then again, the clarification on, as you go through that second tranche of the 20 billion that we walked through, the general distribution, where you apply and attest and to your 2018 tax returns, it's your gross receipts in your business. It's not just Medicare receipts, it's your gross receipts. And they specifically direct you to where to get that out of your tax return. And then what you're doing is that would be for 12 months, divide that number by 12, that tells you what your average monthly was. And then you can go to your March and your April and what were my actual collections in March and April. And then simple math, was there a big difference between the two? And that's what you're putting into that portal.
Yeah.
See, it looks like we had another.
Yeah. Oh, I'm sorry.
Go ahead, Chrissy.
We have another question in here about, but if an employee took a new job during this time and will not be returning, does this affect the PPP repayment? And I was just going to throw in there that it could affect your forgiveness.
It's the forgiveness part. Yeah.
Yeah.
You have to work with. I would have to go back to that section. That actually is one of the questions that was asked and answered in the previous program we did. So I would download that program, and I know that was in there.
Yeah.
If not, the other thing too, with some of these more technical questions, I still am working with those 3 employment attorneys, and this is all they do. And so I can pick up some information there too, and we can use that, Christy, to get out to everyone.
Good. And we don't know what this second payment's going to be. I have not read a formula. They're just asking, how much did you lose? Basically,
we haven't had anyone get anything yet, so that we
haven't anybody get anything, and so I don't have an answer for that. I don't think that was a question, but I thought I'd throw that out there because that's a question in my mind. Good.
Okay.
I think that's everything. I don't see any more in here.
No, hopefully that was helpful.
Yeah.
All right, everybody. Well, if you think about questions while you're watching today's webinar recording or after today's webinar, feel free to email me at Christy@ChiroHealthUSA.com, or you can email directly to info@ChiroArmor.com, and we will respond and get those questions answered for you. Any questions submitted in the chat box during the recording are automatically emailed to me, and I will distribute them to the team at ChiroArmor to get those questions answered for you. And let's see, what do we got coming up next week? We have Dr. Dave Klein, whose birthday is today. He is going, or no, he's not a doctor. Dave Klein. I'm sorry, y'all. And he's going to be talking about proper modifiers and time code usage and documentation on Tuesday. And then next week on Thursday, Aaron Reynolds and I will be here to talk about the no touch practice. It doesn't mean you're not touching your patients. It just means your patients aren't touching anything. Talking about what happens when we go start seeing more patients in the wake of COVID-19. And I don't know what Dr. Munsterman and friends are going to be talking about on Wednesday, but as soon as we figure what that is, we will let you know. So be on the lookout, because you know that we're going to send out an email to you on Monday morning to let you know what this week's and upcoming webinars are going to be. And we will be having June and July posted real soon, so you can see what's coming ahead. I want to thank y'all so much for taking time out of your incredibly busy days to join us on this webinar series. And we look forward to seeing you next week. Bye.
Thank you, Christy.